welcome to Nurse Table Talk. I'm Nurse Julie, and today I have a question for you. Have you ever had your vitamin D levels checked? Has your doctor ever mentioned it? It's really a good idea. It's like knowing what your baseline blood pressure is or your cholesterol is. I think vitamin D is just as important to know. Usually it's not included in our routine labs when we have them drawn. You may have to ask your doctor, hey, have we ever done this? I would really like to know and understand what my levels are. Can we please do this? Now, there may be an additional cost. I haven't had to pay a huge amount of money, but I did have to pay extra for it. And really, I feel it should be part of our normal labs because it does impact our body. So what is vitamin D? Well, it's an essential fat-soluble vitamin that we take in from certain foods and through sunlight. And it does a lot of things, like it helps with maintaining strong bones. It helps with absorption of calcium and phosphorus. It helps reduce inflammation. It helps support a weakened immune system. So for those reasons, it's really important. And the fact that it's not included in our labs is just astounding to me. But anyway, moving forward. So how do you know if you're deficient in a vitamin D? What are the signs and symptoms? Well, maybe you're not sleeping well. You know something's off with your body, but you just can't pinpoint it. Maybe you have vertigo and never really realized that vitamin D can impact vertigo. You may want to research that on your own and look that up. Check it out. BPPV, vertigo. Mood swings can contribute, muscle weakness, aches and pains, your bone pain, depression, feelings of sadness, loss of appetite, getting sick more easily. You know something's off, but you can't quite figure it out. Check your levels. Have them check your levels. So other things that contribute to deficiency in vitamin D is gastric bypass surgery. Medications are huge, and always look at the insert and see if that can deplete your vitamin D levels. Doctors may not be aware of all the medications that do impact vitamin D. Also, living in northern climates, sun exposure, maybe you're covered up a lot when you go outside, or you stay indoors more so than being outside. Elderly people may be, they're avoiding the sun. They don't want to be out in the heat and get dehydrated and things like that. So that's another reason. 65 plus, age-wise, you may want to have them checked. So sunlight triggers a chemical on our skin to activate an active form of vitamin D. And then the foods we eat, such as oily fish, such as salmon, mackerel, sardines, consuming fortified milk or fortified cereal, there's another way to intake vitamin D. Portobello mushrooms, beef liver, chicken breast, dairy products. But again, there's certain foods that are higher in vitamin D than others. So you can always research that as well. Anyway, get to know what your baselines are. Have it maybe checked once a year. See if you need to take a supplement. Your doctors can recommend that based on finding out what your levels are. And measuring vitamin D, they go by nanograms per milliliter. And so some experts say you should be over the level of 20, because less than 20 is pretty severe vitamin D deficiency. And you may notice that by how you feel. Vitamin D in the range of 30 above is good. And when you start getting closer to 100, you may want to back down. I asked the pharmacist, she says, well, Julie, you really want to be around 30 to 50. I said, well, what's toxic? She says, well, if you know your levels, you talk to your doctor, but at the same time, if you start pushing up to 100, maybe you need to back off on something. So again, check with your physicians. I'm not recommending what levels are bad and good, but again, below 20, I know is pretty deficient. If you're between 30 and 50, I think that's where most experts want to see you. And if you're above that, maybe you need to talk about maybe decreasing supplementation if you're on it a little bit. I mean, you want to keep your levels up, but it's a balancing act. So anyway, check with your doctor. Maybe consider having it done if you've never done it before, as far as getting your levels checked, and let me know what you find out after you check. Has it been a good thing? Let me know. Leave a comment in the comments section. Please subscribe, like, Share the video to help this channel grow. Thank you so much for watching, and we'll see you next time. Bye now.
Like the content you just watched? Hit the like button or hit subscribe here. If you want to be notified of any future videos, please ring that bell. If there's any topic you'd like to see discussed, leave us a comment in the comment section. Nurse Table Talk. Save time, save money, be informed. Thanks for watching.